I am Mrs. Akani Yetunde. I'm from Nigeria, from Port Harcourt precisely. I am not actually the patient, but a patient attendant. My husband is the patient in this hospital, Mr. Sachnda Akani. He presented with a case of stroke and also a swollen at the back. We got connected to the hospital through a friend in Nigeria who had been here before. That friend of ours came and insisted that we needed to be in this hospital. We got into this hospital around 11, I think some 15 minutes to 12. And the doctor saw my husband exactly 5 minutes after 12. That's just barely 20 minutes from the time we arrived. What other efficiency can we be talking about? We got a good rapport from the doctors, from the nurses. Almost everybody we came in contact with were ready to listen to us. And immediately he was admitted and treatment started. By 1 o'clock, he had the first investigation done. And before you knew what was happening, the next 2 hours were already in the ward. In the ward, the floor manager was there to attend to us, to talk to us, introduce himself. Everybody made us comfortable. And in the process of treatment, we were very, very, very convinced that we're in the right place. I'm a medical social worker and also a clinical psychologist. I work with the University of Port Harcourt Teaching Hospital. So I'm already in the health sector. And so I know what it means. I got in here and I saw teamwork at play. The doctors, the nurses, everybody was in charge of the patient. No particular person owns the patient. Referral was made at appropriate time. No particular doctor took over another doctor's treatment. For every health issue, they call in one expert or the other. And so we got the best. And procedures were explained at every particular time. What needs to be done, the implication of what is going to be done, and they made every patient get involved in their treatment plan. And I think that is the right thing for any patient. Because for you to recover fast, you should know what is going to be done on you. Because the doctor is not only working, the patient needs to work with the doctor, and that is exactly what happened here. I was overwhelmed when I got to know that this hospital is the same hospital that was always referred to on Al Jazeera as Indian Hospital. I've watched documentary time and over time on that. I've watched the documentary of that Indian hospital on Al Jazeera time and time again, and I've always wished that one day I'd want to see what that hospital looks like. Only for me to get here and they said this is the Indian hospital. And so one other wish I have is to see the director of this hospital, or is it the chairman, and to tell him face to face, personally, how much I appreciate what he is doing. Thank you very much.